welcome to the members here in the room. And I would like first to introduce Claire Nassiet, that is connected through the line. So, hello, Claire.
Hello.
Just to introduce her, because she was not able to join here face-to-face, but we can have her. Claire is a EIT Health member, is a network organization co-founded by the European Union and gathering more than 200 organizations, all committed and bringing health innovation to patients and systems. Here today, it's especially important because he can put the perspective on their unique position that DIT Health has to really to think about the skills that our professionals need and demand from the healthcare employers, hospitals, companies, research unions, and also supply from education providers, understand what's needed for the future. And what we are hearing from our network about challenges and closing the skill gaps that we have in healthcare and attracting talent for the future and how we really be ready for adoption of innovation. After we have Carla Ruiz. Carla Ruiz is Human Resources Director at AstraZeneca. Astra was mentioned this morning several times because they have just announced that they have a big hub in Barcelona and an investment in research and development here, a reference center in Europe to build a corporation with 800 million euros investment and 1,000 new employees. So welcome, Carla, and thank you for being here.
Thank you. It's a pleasure for me to be here with you.
Emilià Pola. Emilià is Executive Director at ICREA. ICREA is a Catalan public institution which hires scientific talent in all disciplines. ICREA selects and hires the best researchers to come and work in universities and research centers in Catalonia. And ICREA has been doing very well for 23 years already, and it now employs about 300 researchers in all disciplines, which is also a very special institution and very good, and it has become one of the most prestigious research communities in the world. Welcome, Emilià.
Thank you. Thank you.
And Marc Soriano, research and development, is a biologist in PhD with 10 years experience in Almirall. And he gained working in academia, and he will give the perspective from their research and development and in big pharma that he has also had the pleasure to be working in San Francisco and Glasgow and Basel, and today is part of the leadership of Almirall Research and Development, and also is pushing for the transformation of the company and very focused on research and development in dermatology, but also in many areas to attract talent as well. So welcome, everyone. And I would start already with the first question, and I would start with Emilià here. And I would like to ask you, and I would ask the same for every one of you, what are the main challenges in your institution or opportunities, but also how you make sure that you attract talent in your institution?
Thank you. It is a difficult question. We have a number of challenges, presumably different from my colleagues in the panel, because of course we're a public institution, and also because we do attract people from all disciplines, from, I don't know, historians to linguists to cosmologists, high-energy physicists, but we do also have biologists and people who work in the life sciences. And in fact, life sciences is our largest sector because the system is very attractive. And so that's the first challenge. I mean, we depend on a system that's attractive enough for the best talented individuals to want to come and work here and become part of our society, really. We don't want them to be part of our research system only. We want people that you can bump into them when you go to the supermarket, that take their kids to school, that go to birthday parties together with everyone else. So that's the goal, is to try and change how society works. Now, challenges. We need to be attractive. That's easy, but if we just break it down into different categories, well, there's a number of challenges, the main one being research funding available for research, for a researcher, the availability of enough funding is a critical issue, and they're not going to come if that's not happening. So there's one thing. The attraction of the dynamism of the system is another one that very clearly we've seen how Joel was talking in a previous roundtable about how we have seen over 20 years our system has entirely changed, and we've become far more attractive. There's far more institutions, far more projects. That's a challenge, but we need to keep feeding that. We cannot stop creating new network or expanding our research network. Let me just put it like that. So there's that challenge. Then there's a gender challenge, and this is particularly difficult for us because we're hiring senior researchers. And when we choose the people that apply to our quals, we are forced to choose from what we have. And at that level of seniority, there's a lot less women than men. We are essentially trying to, we work with a population that is about 80% male, 20% female. ICREA is better than this, but we're facing that, and it's difficult to work on that challenge from our perspective alone. And then there's other issues important, like when you're going to bring a researcher here, you want to make sure that the place is attractive. So they're bringing their families as well. So husbands, children, all these people need to be also integrated. And that's a challenge we have. And then we have this public sector attitude towards hiring people. ICREA is doing things in a very different way from the usual way of attracting, that the public sector has to recruit people. And we want to think ourselves as innovators in this. We are forcing the system to make it more agile, more flexible, and in a way more attractive to people coming from abroad who don't necessarily speak Catalan or even Spanish. And so they have this special set of, let's say, conditions that we need to cater for. And we want a public system that is able to do this. So we keep forcing it and pushing it out of its usual ways to try and do this. But ICREA is a very small community, and the public sector is a big house. So that's another challenge.
Thank you, Emilià. You mentioned, I think, I would take three things here. One is there being a public sector also. You mentioned sometimes challenging on the public funding and also the process that you have there. You also mentioned something interesting, that going beyond and just making sure that you create the space for the families and it's beyond their work and having researchers here. And with that, perhaps I turn over to Carla just to just throw the same question. What are your main challenges? You just need to grow in a very short term. And I think a great opportunity for a city and for a talent. How you manage doing that in such speed?
Well, I think that probably most of us, we have same challenges, but from a different point of view or approaches. In this moment, we need to build an incredible global hub in Barcelona. You have already seen numbers this morning regarding clinical trials, regarding the ecosystem you have built in the past years in Catalonia. So now we need to continue with this. We need really to guarantee that the global hub that AstraZeneca is building in Barcelona is amazing. We need really to keep the balance between public institutions, private institutions, collaborations, internationals, because at the end we are building something from scratch. We need different profiles, different backgrounds. So we are thinking in global, we are thinking in talent that we can find here, but also in other continents or other countries now. When we are talking also about diversity, we need to think in men, women, other cultures, another point of view, and we need to guarantee that all the employees are feeling integrated And it's true that we have a challenge for attracting people, but we need to have in mind that we need to retain them and also develop them, because if not, we are going to fail in the long term. No? So an amazing project. AstraZeneca is putting really a huge effort here. We are really proud of this, and we are sure that we are going to have a lot of collaborations in Catalonia for continuing growing this.
Yeah, I think, no, thank you, Carla. I think there are several things here you mentioned also. Some of things are commonalities on there, no, integrating people that are coming from different places. Also at the same time, you mentioned the technology piece, which is, I think, an important one that brings an interesting approach and diversity. And Emilià also mentioned the gender difference here. Perhaps here, Carla, you just looking at this, and we can come back to this later. And I would perhaps give the word now to Claire on their skills and upskilling, how you do that and how you work with that in EIT Health at European level. Can you bring some light on what's your institution doing and what are the challenges, opportunities you're seeing?
Thank you, and apologies for not being with you in Barcelona, but hello from Paris, where you can see the Eiffel Tower in my background, hopefully, if it works. So what we hear from the network and the ecosystem is some things that have already been mentioned by the panelists. There's an element of extending your network or your partnerships outside of what you already know. Because we see that companies, hospitals, when they recruit, they have great relationships, partnerships, collaboration with the institutions in their own local ecosystem. Some go a bit beyond others, but what they're saying and where they come to EATLs is, okay, can you help me develop a new partnership with a group of academics, a group of university in this region in the country, or in a completely new country in Europe, because I will set up a hub, because I will have to collaborate with the research team in this country, so I need to expand in a way the talent pool and the talent pipeline. So one element, I think, is challenges in extending the way you recruit and the way you talent beyond your local territory, your local ecosystem. And here, EATLs is an organization, as many others, that work on a network and the richness of the network, so you can build those bridges. Another challenge that we hear is that when you have those partnerships, or your industry, you have that partnership with a great academic institution, it's been going on for years, but still the people who you recruit, they are not entirely fitting your needs. So there's still a mismatch between the people who come out of the university or the different training programs and what the industry expects. And one of the industry members has put a price tag on that mismatch, or has tried to build a business case, saying that when the person comes into their role, so it's mostly biomedical engineering, biomanufacturing processes, they are lacking about 30% of what they should have. And so it takes the company 6 months, sometimes even 10 months, before that person is actually productive and operational and can actually contribute value to the company. So that is also a challenge, and maybe we have a question on solution later on, but I think the solution is about discussion with and long-term partnership to address the current gap that we know yet, but also projecting and forecasting the future gaps so that we can already develop long-term solutions.
Thank you, Claire. Here, you highlighted something that is very important, also was mentioned before, around their collaboration with different institutions and how we sit down together and we discuss what are our needs for the present and for the future. Another thing that we can come back later, also you mentioned that sometimes there is always a gap from people that are coming out from the university versus needs that you have when you get in. You mentioned also there medical engineering, a technology piece, and it's also a lot around artificial intelligence that has not been mentioned before yet, but the skills that we'll need in the future. We will come back to that later, but before that, I will hand over now to Marc, based on your organization and just after your colleagues' highlights also, in your perspective, what other challenges that you have on a daily basis in your organization to attract talent?
Well, as you say before, one of my challenges today is to set the Almirall Science Hub, and this is about talent. I see three major challenges on talent. One is the definition itself, the attraction that we have been already commented, and as well the development of this talent. We are today in a very changing environment where new technologies, new needs arise all the time. In that context, how we define talent. And it's about doers, it's about thinkers, it's about leaders, it's all of them. Our value chain is long, it's complex, it's risky. In that context, I mean, we need very specialized talent, but from the drug discovery to development to cover all these needs. On top of that, I believe that we need talent that is resilient, is diverse, is collaborative, and is resilient. And we need that talent to be adapted to this change, to constantly change. If we have that, maybe it will be as well to retain and to keep the talent in our organizations. Second is talent attraction. Often it's very difficult for us to attract top talent at international level. Well, in this case, it's because although we are in a fantastic ecosystem, as we have seen today, and a great city, we are, let's say, competing with Boston, London, Berlin, Shanghai, and a few others. Those top places, they have strong investments, they have very successful stories in life science, and as well they have top talent. On this regard, what I think is to overcome this is we need to communicate very well what is our purpose, what we are aiming to do. Today's talent, they work based on the impact that they will have on the society, how they align their values on what they do, what are the meaningful projects that they work. If we do that, I think it will be a way to attract and to stay here. And last is about talent development. Today's leaders, they have an additional responsibility, that is to generate a safe space that this talent is able to come with their skills and put everything on the table. This talent needs to explore, to innovate, to challenge, to try, to fail, and to learn. And then we need to continue investing on developing the talent, but as well investing in tomorrow's leaders. And basically, it's to transform the managers that we have today in talent developers. These are the three main points.
Thank you, Marc. You touch base several things here. One is making sure that we attract talent from international, which has been already mentioned. I think it's a commonality among all the speakers here. So people from all around the world, how we make it happen. You mentioned something interesting also that has not been just mentioned before. It's there are talent that they need to be very specialized, but also that at the same time they need to have leadership skills. The other thing is how we make sure that we get these abilities on people that sometimes are so specialized and get in research deep early discovery, how we make them leaders, which is needed. Mm-hmm. And the third piece that you mentioned something also important, it's they want to make an impact on the society. How we define impact on the society and how what the young leaders they want for the future. And this, I think, links to the next question that I would like to throw here, and I would start with Claire now. If we foresee now in the 5 to 10 years, but just 10 years seems very far away, not even 10 years, 5 years. Tell me, what do you think are the main challenges that we need for sure to solve today to be successful? Claire?
I think one is the attractivity issue, and we mentioned that. And I think part of the issue, the main issue, is that a lot of companies across sectors are competing for the same talent. We can start with the obvious example, the digital and data skilled people. They have a luxury of choices because pretty much all of the sectors needs this kind of skills at a rapid pace. And so they are in the strongest position to choose their sector. And there are a number of studies when you ask kind of younger talent, 25, just coming out of a master of engineering or data science or something, in which company they would like to work. There's only one company in the health ecosystem that features in the top 30 companies, and that's Pfizer. And that's pretty much down to the COVID vaccines, because it was not there before due to the vaccine. So I do agree with Marc that there's a lot of work to do as an ecosystem, but also each individual company and employer. What is the positive impact we are making on the society, on the patient, on the innovation, on the hospitals and the healthcare ecosystem to attract the talent? Then I think the second challenge is there's a lot of skills that have been mentioned by industry and employers as pain points for the past years, but nothing has changed a lot or not changed fast enough. For example, the regulatory affairs skills, it's been mentioned for years and years that in the medical devices companies, in the pharmaceutical sector, in the notified bodies, in the hospitals, everyone is lacking people with regulatory affairs, and it's a field that changes quite rapidly, so there's an element of updating the knowledge very quickly. So now I think one of the solutions, or one of the paths that is worth considering exploring, is how we use this momentum post-COVID at European level, but also in other level, at country level, with everyone saying we need to be sovereign again, we need to produce again the vaccine and the gene therapy and all of the equipment that we were lacking during the COVID, and so we're putting money on the table for the factories and everything else to be reinstalled back in Europe. And we're also putting money on the table to invest in reskilling or upskilling of people. So there's a momentum that we need to leverage and build long-term relationship and partnership between the demand side and the supply side to figure out the upskilling efforts.
Thank you, Claire. One of the things that you mentioned, I found it interesting, probably because I'm biased, and you mentioned that the healthcare, it's not an area where many professionals think about when they think about their future professional career. And it's not even about talent development, but it's how we make sure that we create a good branding, if that's a word, around the importance of these healthcare needs for the present and for the future, and how needed are the professionals there. Thank you, Claire. Emilià, what's your view on the main challenge in the 5 years? What do you need to get solved to make sure that you're successful in your institution, in ICREA?
I think that our biggest problem is going to be the increased competition. If one thing is clear after listening to the conversations today, is that it is true that bright people keep being born everywhere around the globe. We're not questioning that, but we're not the only ones fishing. There's a lot of people looking for that, and more so. So we used to think of talent as something that was like essentially an unlimited resource, and I'm not sure how long this is going to hold true. I think soon we will start finding that it's going to become difficult to source it, because we will have trouble finding it and a number of things. So essentially, I think we need to brace for to stay on top, to keep doing what we do well. We're going to be, need to be prepared for stiff competition coming from our colleagues at the table, for instance, but obviously not only from them, but from everyone else investing in knowledge. Nowadays, this is essentially everywhere. Yes, that's
an interesting approach, because you're talking about the increased competition for the talent. And it was mentioned before that we are in an amazing city, that many professionals, young scientists, they are happy to come to Barcelona. But there is also a challenge if we are dying because of a great success, and how we make sure we have a healthy competition to attract more talent. but making sure that we get talent for all kind of institutions that are really needed, because your institution is really a reference around the world, making sure that we keep a good talent coming.
But it's a small thing. I mean, we're hiring 20 people a year, and my colleagues here are hiring hundreds of people every year. So it's small. It's very specialized in doing one thing and doing it well. And the city helps, and everything's fine. I mean, we're okay. But the thing is, I believe, I fear, I don't know, I think that the landscape will change in that direction. It's going to become harder because everyone is hunting for the same thing, really.
Okay. So you will work to make sure that this is going to become harder.
Yes.
We need to do something there to make sure that you are able to attract these 20 people that are high level,
Like
right?
the top, yes.
Okay.
And the devil is in the details. So we need good housing, affordable schools. I mean, people bring their children. We want them, we don't want an international school where they are nested somewhere else and they don't mingle. We want them to be integrated in our school system, in our cities. They need to be part of our culture. These things matter.
Okay. Marc, 5 to 10 years, what do you need to fix?
Well, I'm just thinking more on how I would like to see in 5 years about talent. I would like to see more on a very interconnected ecosystem where talent can move from different organizations almost freely, where the knowledge is as well shared. I see that the ecosystem has to become a kind of community. That people are moved, challenges are shared, and we have a kind of global view of where we want to go all together. Okay. We cannot deny that Barcelona is a fantastic city, and we have a great private institutions, public institutions, fantastic hospitals. But on top of that, there are other things that we need to improve. I mean, we need much less bureaucracy, for example, to facilitate the arrival of the talent. We need to improve the mobility of the area, because that's something that we are not there yet, and we need to have successful stories. Because at the moment, we communicate, there are very good paths, but we have been seeing this morning, the number of phase 3s are large, but compared with the number of phase 1s and phase 2 studies are smaller. And this means that the innovation part still not being as we should be. Okay, that's more how I see it.
Thank you, Marc. Carla, 5 to 10 years.
5 to 10 years, really far away, no? If you ask me, you have been successful there. I think that as a framework, as a company, we need to develop innovative drugs for generate two pieces. First of all, generate a significant impact in people's health and add value to the healthcare system, no? And how we are going to achieve this? With people. Putting the people in the center of everything we do is the best asset that a company could have. And for this, we need all the things that we were talking before. We need to guarantee that they have the feeling that they are integrated, not just in the professional environment, also in the personal life, in the city, in all the ecosystem also, no? We need to guarantee that we have professional path. We offer them a career to continue their development in the company. Also, we need to be really aware what's happening outside, because probably the skills that we are looking for today are radically different than 5 or 10 days before. In fact, now we are competitors of our companies that we were not expecting. We need artificial intelligence, we need biometrics experts, we need statisticians. So it's something that we need to continue learning and improving because it's going to be basics for guarantee the successful story.
Now that you mentioned something that it's about their knowledge that their professionals need to have in the future, you mentioned artificial intelligence, you mentioned technology. Do you think that their universities, their older systems and their contents of our academics are already adapted there, or something that we need to focus as well? So for Carla and also Emilià, that you're also very close to the academics there, are we well there, or we need just to also call for action?
I don't know. I'm not perhaps the person to talk about this because we are close to the academic, but we're working with putting people into our academic system, not students. And like, so, and I don't know. I think it's difficult for everyone to stay on top of a moving field, and this is very much what happens to all institutions, of training institutions, higher education institutions. They face a lot of challenges, and some of them come from constant changes of disciplines. But these disciplines change because someone is developing them, right? And essentially we're focused on that section, those people who are actually making, creating all these technologies that we can't imagine today. I think if we get a lot of talented people and we give them time to think, a lot of good things usually happen, and then that spreads. But it's obviously like a never-ending. It's a moving target, and it's increasingly difficult for companies and for higher education institutions to actually provide that. To say nothing of the fact that no one really knows what it's going to. So it's like it depends on a lot of things. Bright people just coming up with something that's totally disruptive, and then everyone goes. So there's a balance that institutions should try to find between running after the latest new thing and training people on the basics and the skills that let them acquire different backgrounds later. But like I said, I'm not an education expert, so.
Good, thank you. Marc?
Yes, I think the universities, they have the right level of what we need. What it happens is probably we need to get closer, the industry with academia. I mean, we saw it this morning, only 3% of the doctorates are industrial doctorates. I think we have something to promote here, as an example.
Good, thank you. So I think you bring on the table some important things on these 5 to years time, and Claire mentioned something also before under healthcare branding piece, which is something that perhaps it's not about talent, but some work that in theory could be easier just to create and think. You also, Marc, mentioned something about creating community of talent, and more we have, I think we need to expand the view there and to make sure that these talents that we have in the city, and you mentioned also how this evolves and these differences on the technology that is needed, how you make it happen, and to make sure that this community that is coming here lives in a place that it's not always about talent, but the families and the surroundings are well prepared to be successful and to stay here. And you mentioned something also important, which is we should monitor on a very frequent basis, because this is a moving needle, that it's not, this is what we need, and without revisiting that. So this means that we need to stay very awake and to make sure that we keep that in a good pace. To close their session, I would ask each of you to summarize, if you think about when I go back to your place, what are the focus that you will make sure you pay attention on? Based on what we discussed, something perhaps it's not new, or something that after this you say, okay, I would get back and I will focus on this to keep the success that you're having already. Marc?
Well, I think one of the things that I take from today is that this, we are in unprecedented times of change and disruption. We are all here to discover tomorrow's medicines for today's diseases. And this battle of the talent is a sign that we have a really meaningful projects to move forward. And that's why I think it's important, and we are here for this.
Thank you. Claire?
Thank you. For me, is that somehow we share a lot of challenges and sometimes beginning of solution. And me coming from an organization that gathers people around the table so that we can have the discussion. For me, part of the answer is who do we need at this discussion table? We need the industry. We need all different profiles to figure out this equation. We need the industry, we need the academics to refine the academic offer, we need the talents themselves to also better understand the attractivity challenge issue. But for me, the answer is in collective collaboration and getting there together. So setting up new partnerships or reinforcing the ones that exist.
Thank you, Claire. Emilià.
Well, tying in with what just Claire said, I think in our case, where we need to focus is on making research better and creating the conditions for that that make it possible. Because these conditions not only help academic research, it makes a better society, it makes a better public sector. It helps us all. Right? The conditions that a researcher needs are not that different. They don't come from a remote planet. I mean, they have the same needs. And so by creating an attractive place, we're making, we're hitting many birds with the same stone. We're changing many things. So we need better conditions for research. That would make a more attractive city, in our view, mainly, but I'm sure also in everybody else's.
Thank you. Carla.
So I really align with my colleagues. I think that we have, all of us, independent of public, private, company, academic, we have a main objective. That is make things happen, connect, collaborate, and put the focus really in the people's health to achieve really added value proposals for the healthcare ecosystem, for everything. And maybe in 5 years, 10 years, we are here all together again saying we achieve it, we have identified ways of collaboration, and we have done amazing things because I think that we have an incredible path coming.
Thank you. So we are already at the end of the roundtable, and I would like to just thank you, Marc, Claire, Emilià, and Carla. And I just couple of words on my side because listening to you, I think it's. I feel the passion, how important it is to develop talent, to attract talent. I think we are in a very good position. At the same time, you mentioned something important. It's sitting together and collectively to share what are the needs for our talent in the future and to work together. I think BioCat is a great institution to put a lot of people together from the academics, from the private, from the public, from the administration. I think we cannot be in a better room here to think about that. So perhaps we have also some additional homework to do together. And thank you for all their thinking here, and thanks to the audience as well.
Thank you. Thank you.